This one is showing about a picture like gluteal area. How to identify the gluteal area? This is directly a sciatic nerve, and you see here is the muscle, and here has to be sacrum, and here it has to be the bone called greater trochanter. Just keep in mind this is greater trochanter. You palpate on the lateral side. What is at the level of thigh? You palpate the greater trochanter. So muscles are basically attached to this greater trochanter. So this superficial, this muscle is cut. That is gluteus maximus. This muscle which is cut, and then these are below the gluteus maximus. These are gluteus medius muscle which is attached to the greater trochanter. Now horizontally, this is piriformis. So below piriformis, you get the vessels. Above is superior gluteal artery, inferior gluteal artery, superior gluteal nerve, inferior gluteal nerve. Then the vessels which go back. So greater sciatic foramen, and then inner lesser sciatic foramen, which is going deep inside the vessels, will be pudendal vessels on this sciatic nerve. The difficult thing is the muscles which are attached to the greater trochanter. These are superior gemelli, inferior gemelli, obturator, and quadratus femoris. So what are the questions? Posterior aspect, from which side? It is right side. Muscles A to G we are identified. Nerve exerts pelvis above the muscle superior gluteal. What muscles? It supplies medius and minimus. Functions of this muscle is abductors of the hip. How would damage to the nerve manifests itself? Tendon sign for H to AK near identified sciatic nerve, pudendal nerve, superior gluteal, and all that. Arteries, L and M, superior inferior gluteal arteries. From which artery do these two vessels, the internal iliac artery, superior inferior gluteal artery, are the branches of internal iliac artery, through which foramen and two arteries exits greater sciatic foramen. Bony prominence marked N is the muscle inside gluteus medius and maximus. Bony prominence sign is the greater trochanter. What structures are cut during the posterior approach to the hip joint? Skin, subcutaneous, gluteus fascia, maximus, short external rotator, and joint capsule. What nerves are risk? Sciatic nerve and the gluteal. So this is another again femur. Now when you see this ridge, it has to be the posterior aspect. So that is the main thing. And here what you see, this is the posterior aspect, and this has to be on the medial side, this has to be the lateral side, and the medial side of this is always touching. When you see opposite side, when you stand, these are very close to each other. So this angle is around 130 degrees. So posterior aspect of the right femur. What you are seeing, this is the head of the femur, neck of the femur. This is greater trochanter, lesser trochanter. Posteriorly it is very thin, and intertrochanteric crest is there, and K is the gluteal tuberosity. This one is a gluteal tuberosity, and this is J is a. So what you see, this is linea aspera. So bone is from right side A to K. Now this is lateral epicondyle, this is medial epicondyle, G is medial epicondyle, and F you see the adductor tubercle. This is on the adductor sides. Blood supply to the head. Median and lateral circumflex arteries, they form a large anastomosis, ligamentum teres, then superior inferior gluteal artery. A lot of anastomosis. What is the significance? So it has got significance avascular necrosis, muscles in the anterior compartment of the thigh. So anteriorly you get psoas muscles, quadratus muscles, pectineus, iliopsoas, tensor fascia lata, sartorius, and quads. blood supply to the medial compartment of obturator nerve. These are the adductor muscles. What is cutaneous nerve supply to the outside of the thigh, lateral cutaneous nerve of thigh? What is dermatome L2-3? And what are the surface markings of this nerve used to perform the nerve block? Surface marking attributes the one to consider medial and inferior to the anterior superior spine and nerves passing below the inguinal ligament. What are the terminal branches of sciatic nerve? It divides into tibial and common peroneal nerve. How do we test the sensory motor functions of L5 root? Now L5 is going up to the great toe. Motorizes extension of the great toe and dorsum of the foot. Next station, you get a picture like this. This is commonly of the femoral triangle. You see the triangle boundaries. She's asked, this is inguinal ligament, this is sartorius muscle, this is the medial border, or lateral border of medial border of adductor longus. Medial border of adductor longus, because this one is adductor longus and this forms the medial side and this one is the lateral side. So this is medial border. Now these are the boundaries of femoral triangle, and now when it comes the important part, the structure is the contents. So it has to be the most medial is contents of femoral triangle from lateral to medial is navy, nerve, artery, vein, and lymph nodes, or vein, artery, nerve, vein, artery, and nerve. So you get a femoral vein, and this is the femoral, it has to be the femoral vein in this manner, femoral artery, and the nerve. So when the femoral artery is in the center, this is the mid-inguinal point, and you know, pulsation of the femoral artery is felt, and whenever blood sample is taken, it is medial to the femoral artery through the femoral vein, artery, nerve. So the question then comes, the contents of femoral triangle, then A, B, C, D, what the things we have to mark out in this. Starting from A is adductor longus, V is sartorius, C is this one, C is the inguinal ligament, it has to be inguinal ligament, and D is the laterally femoral nerve. Femoral nerve is a, then E is femoral artery, and F is the, this one is a femoral vein, and this is opening into saphenofemoral junction. This one is saphenofemoral junction, saphenous vein, great saphenous vein or long saphenous vein. Then H is gracialis on the medial side. Then you see I is rectus femoris muscles. So this is quadriceps in the rectus femoris, lateralis, tensor vastus lateralis, rectus femoris in the center, vastus medialis, and this one is tensor fasciae lata. So floor of the femoral triangle, you see the muscles. If you remove all these structures, you will see the floor. The floor roof is formed by the fascia lata, and the floor is formed by, now this is adductor longus. From here, this will be iliacus muscles from the iliac bone. So iliacus muscle will be like this. Then you get a psoas tendon, pectineus, and this is adductor longus. Iliacus, psoas, pectineus, adductor longus. Femoral artery is located 2 to 3 centimeter below the inguinal ligament. So femoral sheath is facial tube. Femoral artery. The femoral sheath is a facial tube that extends for about 3 femoral sheath. Now what is the femoral sheath? So there is artery and the vein. The tube below the inguinal ligament surrounds the femoral artery, vein, and canal containing. So nerve is not in the sheath. The sheath will be artery. This is the artery, and this is the vein. The femoral sheath is like this. Vein and the artery is there. Nerve is outside the sheath, and there is medial most part contains the lymph nodes. And medial part is called as femoral canal. So this is the canal. Most medial part component, it contains fat, lymphatics, and Clockett's lymph node. Superiorly, femoral canal opens into femoral ring. Femoral ring. Now this has got the boundaries. So lateral, it has got the anteriorly there will be inguinal ligament, posteriorly there will be pectineal ligament, medially there will be lacunar ligament, and laterally there will be fissure on the vein. So you get the picture like this. Now what are these pictures? So here you see this are the thigh, this one is the artery, distal subtraction endography, and when you get a posteriorly branch, and this is continuation, posterior profunda femoris artery, continuation is superficial femoral artery. So it has to be to the left leg because this is little bit laterally. Now when it goes down, superficial femoral artery goes down to form anterior tibial artery, and F is the tibio-peroneal trunk. Then this divides into posterior tibial artery, and H is more superficial, posterior tibial, and G is a peroneal artery. So posterior tibial, anterior tibial continues down into dorsalis fasciae, posterior tibial pulpit on the medial malleolus. So here you get dorsalis pedis, lateral plantar, and then there is a popliteal artery. So this investigation, dissection, subtraction, vascular supply of the leg, identify the vessels E to J. So we identified the vessels and describe the course of long saphenous vein. So it starts on the medial side of the malleolus, it goes up, and then behind the medial epicondyle, then goes and opens into the femoral veins. Nerve, close proximity to long saphenous vein, saphenous nerve, where the nerve arises. Saphenous nerve is a continuation of the femoral nerve. What does the nerve supply? Medial side of the calf. What is the relevance of the vascular surgeon? Damage to the stripping will cause the arterial substructure beneath the third of them. What are the boundaries? Medially, you get the sartorius, laterally vastus medialis, and posteriorly erector magnus muscle. What structures run through it? So the structures running are profunda. The structures which run are femoral artery, femoral veins, saphenous nerve, and one or two vastus medialis. The significance of this canal is narrowing common site for the turbulence blood flow. So this is another structure. We get a knee joint, and that lateral femoral condyle and medial femoral condyle. This medial, this one is a space, and you see these are the attachments. So these are the points. You call this as a medial meniscus, M A, anterior cruciate ligament, L A M. So again, this is medial meniscus. This is medial meniscus on the both sides. Medial meniscal ligament ends, anterior cruciate ligament, and this is lateral cruciate. Lateral menisci has got all the ends on the very close to each other. So that's why. So A is the lateral femoral condyle, B is the medial femoral condyle, this is of the left knee joint, and this is the patellar groove. Here will be patella, and C is the intercondylar fossa. It's medial anterior cruciate, lateral horn, so anterior horn on the lateral, posterior horn on the lateral, and then this I will be posterior horn of the medial meniscus, and J will be the posterior cruciate ligament. Names A to D. What sort of bone is patella? Is a sesamoid bone. Patella is sesamoid bone. What is the function of patella? It is attached to the quadriceps via patellar tendon. Normal position of lateral collateral ligament. Lateral collateral runs from lateral femoral condyle to the head of fibula. Cruciate ligaments. It prevents anterior and posterior displacement. Function of cruciate ligament. Then what is the cruciate? Which cruciate? Posterior cruciate is more stronger. Cruciate ligament, anterior rotator, posterior rotator. What is anhipotest? Anterior cruciate ligament, anterior cruciate, medial collateral ligament, and medial meniscus. Medial two parts. So that direct blow from the lateral side will lead to. So you get a picture like this. This is the tibia on the left side, because you are seeing on the medial side, medial aspect. So it has to be left side, tibial tuberosity. This is complete. The shin. Lateral side is naked. Attachment is on the medial side. So what is the medial aspect? Where the pes anseris, so Latin goose foot. So this is A, B, C. So sartorius, gracialis, semitendinosus. Sartorius, semitendinosus, and gracialis is in between. Pes anseris. And at the D part, sartorius is from the femoral nerve, gracialis from the obturator nerve, semitendinosus from the sciatic nerve. SGT, sartorius, gracialis, semitendinosus, supplied for femoral nerve, obturator nerve, sciatic nerve. Tibial collateral ligament is attached. So this is one ligament, tibial collateral ligament. And there is patellar ligament from tibial tuberosity. So this is the picture. You see a popliteal fossa. This is the medial side, the posterior of the joint. So you see semimembranosus. Biceps femoris is on the lateral side and semimembranous is on the medial side. This is the left knee joint. So this one is the medial side, this one is the lateral side. You see semitendinosus, semimembranosus on the medial and biceps femoris on the lateral side. Tibial nerve is the most superficial, and tibial artery is the deepest. Common peroneal on the lateral side. So it goes, common peroneal rotates around this. Sural nerve is the superficial side. Where does the F divides? So common peroneal divides superficial, and what does F divides into superficial and deep peroneal? What are the boundaries of popliteal fossa? You have seen what structure contained within a deep to popliteal artery, popliteal vein, tibial nerve. Deep to superficial is tibial nerve, common peroneal nerve. What does popliteal artery begin? Adductor hiatus. At what level does popliteal artery bifurcates? Lower border of popliteal fossa. Into which two vessels does popliteal artery branch? Antitibial and tibial trunk. What is the action of popliteus muscle? Locking and locking of the Baker's is extrusion from the bassa. So this is another stem. You can see the tibia and fibula. This is the, so this is on the right side. It has to be of the, because this is the lateral part, this is the medial part. The shim of the tibia on the medial side is, there is a great saphenous vein. This is superficial compartment. This one is superficial compartment, and this one is the deep compartment. So here this tibialis anterior muscle. So there is an artery, tibialis anterior artery on that. Then there is interosseous membrane like this, and then the muscles of the anterior compartment are these. These are the muscles of lateral peroneus tertius, peroneus brevis, peroneus longus is this. And these are the muscles of deep posterior compartment. These are muscles of superficial posterior compartment. Gastrocnemius, soleus, medial and lateral heads. Then flexor digital longus. This is tibialis posterior. This is tibialis anterior muscle. So M is the peroneal artery. These are the deep peroneal arteries. So great saphenous vein. Here is again there is superficial saphenous vein. So compartments are four structures A to A. What are the names of superficial structure labeled O and P? So superficial great nerves next to the structure labeled O and P. So great saphenous one, there is saphenous, and this is sural nerve. Arteries L and L. So deep nerve, tibial nerve and deep peroneal nerve. Foot drop. What is the lower limb compartment? Tibialis anterior, extensor digital longus, peroneus tertius and extensor hallucis. Extensor muscles, hallucis, longus, peroneus tertius, tibialis anterior. So here you get a picture like a medial side of the foot. This is the medial malleolus. Then you got calcaneum, talus, this talocalcaneal joint, and then you get a navicular bone in between. Then this forms the medial cuneiform. Then metatarsal bone, then the proximal phalanx, distal phalanx. So bony prominence, the structures pass behind the medial malleolus. Now these structures which are passing behind this are like this. Posterior tibial artery, flexor digitum, tibialis posterior, tibial nerve. Name of the structure, point B, tendon achilles. Muscle contribute to this structure. Gastrocnemius, soleus and plantaris. These muscles supplied by the tibial nerve. Bones palpated at C and C to I. So these are the bones. Sustained tulum initial from the calcaneum from talus extensor hallucis longus. What is sensory nerve supply to the first dorsal deep peroneal nerve, describe muscle layers of the soles of the foot? So these are the four layers. Superficial is abductor pollicis, abductor hallucis, abductor rigidity, flexor rigidity. So deepmost plantaris, dorsal, tibialis posterior, tibial. Structures and in these layers. So structures, what are the structures around? Plantar fasciatis. So, what are the structures? The medial lateral plantar nerves and vessels and deep branches, the inflammatory process of the plantar fascia.